Hi, this is Dr. Raul Vazquez, CEO of GHealth Enterprises. I just want to kind of convey messages that we try to keep you sort of updated on things that are going on within the GHealth system. One of the things that the marketing team did was actually look at and ask questions, and then we got some response. And I wanted to go over some of that stuff and just bring you up to date on some of the things we'll be doing going forward. So one of the questions that came out was, how worried are you about the impact of the coronavirus on your you personally? And it was just interesting that about 32% were extremely worried, very worried with 25%. So if you look at overall, about 70% were worried of what the coronavirus is personally, how it's affected you. And I think it's affected all of us in light of the way things have changed. And some of the stuff, the change that we have will continue. But like anything, change is often good. And it helped learning how to really manage patients differently and members, but also it helped kind of get better at things we've been trying to push the organization to kind of do for a while. So that was really good. The other thing is, so how worried are you about the impact of the coronavirus on your company? And people were extremely, I think 26% were extremely worried. 22% were very worried, and then so you get about 70% people that are worried. And right now the company has done fairly well. I think we as a system really didn't get touched at all with this coronavirus in the way we model it at Urban or at Gbon, and even at Jabanco. So it's been a God blessing, because we haven't. We've seen other organizations that furlough people. From the beginning, what we did, we actually repurposed people. We try not to get rid of anybody. Some people did quit, but we can't control that aspect of it. But overall, during the storm, we all did really well on this boat, and the boat seems to be continuing to do very well going forward. So that was one thing. Just wanted you guys to know how easy or difficult is it working effectively these days. And so I think a lot of people said it was very easy, 22%. And 31% neither easy or difficult. So at least that aspect of the work component was really good. They did get into what are the top 3 challenges that people had facing them during working remotely. And I think the biggest one was social isolation. I think that's how a lot of us kind of felt, especially if you're living alone, or you have a few people in your home that you live with. That's a real big issue. You gotta, we're humans. People like to be around people. No physical workspace. I think that made it very difficult for people. Internet connectivity. So we'll look at some of these things going forward and figure out how we do, make changes in the future. A few percentages of childcare too, because all these things kind of were not working during this process. Excuse me. I think the other thing that we looked at is think about your current work from home arrangements and how long, was it comfortable? And I think most people were okay with it. I think there wasn't a lot of people that really had a lot of difficulty in terms of functioning, working away, which was kind of nice to kind of hear. But then there was, how often would you like to communicate how your company handles the business? I think most people were talking a few times a week, or at least once a week. I know that each of the managers and we had management meetings occur, and each of the teams were still meeting, so we were kind of, illustrating that. I myself would come on when I felt we needed to kind of understand things that were going to come up in a week or two, because I didn't want to also, there's a lot of anxiety when the CEO has to talk about, is the company okay? Am I got a job? So no news was good news, okay? But at the same time, we were planning to kind of, depending on where things are, probably going back to June 1st. I think that's very reasonable, and everything that we've planned, and makes sense in light of what we're seeing, at least within the population that we have. But we're preparing a lot of the members and the patients to really get tested, and I think that'll make it easier. Protocols are being put together with infectious disease for our system in terms of masks and gloves, in terms of a scanner coming in when you walk in. So if you're sick, you got to get tested. You go home. If you're not, to the clinic, we're going to bring in mostly people that need to be there for chronic diseases, or if they need preventive services like screening tests for chronic disease, spirometries, EKGs, things that you can't do remotely. Anybody sick will actually be managed in their homes. So that's where we're going to be looking at a lot of telehealth still continuing going forward. And in some cases, even home virtual visits with the Title Care. That we're getting enough PPE equipment to be able to do that also with some of the members. I think the other question that we had was, how confident are you in the company leadership? That's a tough question, and I think you often are very comfortable. You know, it was just really nice. I mean, extremely confident was 30% of the response, and that was really good. Very confident, 34%, somewhat confident, 28%. But, you know, that was really good. I think, you know, our teams have grown. We've matured. I know we've been doing this in GBON and Urban for a long time. I mean, this year for Urban is 24 years, you know, that we've actually been working through that process. So it's a more mature entity. But GBON, you know, for its time period since 2013, you know, going on 7 years, has actually matured and done a really great job during this time. So that was always nice to hear from the individuals. You know, I think, how confident are you that the right resources for your company supporting during this time, the things that you had what you needed, and again, between extreme vary, it was almost 60 to 62%. You know, it's like anything. I always told you that 75% of people drink the Kool-Aid, 20% are still deciding, and then 5% don't. But that's reflective of the data. And I think, you know, the ones that are always been here have seen that we've grown, but we've also been very good to everyone else around us. And are we perfect? No, but we try to do the best we can at this point. Outside of work, how confident are you that that there's also, what is it? What's the greatest pleasure you get in working? And it's funny that, you know, that that there was a 8% was funny. They said receiving the salary I take home, that made them real happy. But when you're looking at 25% feeling that they're making a difference in the world, I think that was really touching. And then the other side is delivering a value to our customers and clients. That was 28%. So the majority of the responses here was people enjoy what they do. And I think that's real important. If you don't enjoy what you do, it's really not, you know, you got to find something that you find a place in your life that makes you decide that this is what you love to do. And I think that's what I love to do. I set up the system to do the same. And I think every manager, depending on what they're doing within the system, there is that sense that they love and enjoy what they're doing. And we want to maintain that. So again, we're looking for a June 1st kind of start time, but it can change. And I think with us, is most of the individuals from GBON and Urban and Jabaco pretty much all getting the blood test to get an antibody sort of test. We've had some data that we pushed out in terms of the testing that we've done. And, you know, up to now, and you guys have been able to see it, we've tested 198 nasal swabs for people with acute infection. Only 15% came back positive, an 8% infection rate. The blood test, we actually did 503, 27% were positive with an infection rate of 5%. So we'll give you more information as it becomes available with regards to the testing and how more of the model is going to actually take place. If you have some comments and stuff, make sure that you get it back to your different team managers, so we can begin to kind of learn and figure out how to really do things better going forward. I think, like anything, we're just trying to keep everyone sort of focused on what we're trying to accomplish. But, you know, we get better if you tell us what things we need to improve on. We've been working with the churches, so Reverend Pointer and their group. There's a team out there right now that is really kind of doing certain things that will trigger back to our system. So they're going through COVID-19 questionnaires on mostly the zip codes. That's coming up into our system. And these individuals are being tested for either acute infections or antibody tests. If they don't have a primary care, they're putting into Urban. And if they're not members of GBON, they're going to be basically brought into GBON to really attach them to PHN. So you could expect our growth to kind of be significant in light of all the stuff that's taking place. So those are some of the things that we're doing. Our mobile unit will be coming back sometime in July when we finally get it transferred over. There was a slowdown in light of what was going on, and that'll allow us to do examinations, in remote areas as opposed to having everyone come back to the base. I think the other things that we have is on the Main Street site, when we open up, it's going to go back to the way the same setup was in terms of, the social distancing. The 6 feet, while, we're still debating on that, because that 6 feet, if you're not wearing a mask, if you're wearing a mask, it could be a little less than that, and that's what we're looking at. But the cleaning and all the other stuff, that's a priority. Making sure you have gloves and masks, that's a priority. All those things will be in place. But just the design, we're still going over it. The main street is going to be a little bit more like a health hub. And I think what it does there is we're going to be doing a lot of other things, telehealth and arranging a lot of different services from that point, which, be individuals that we may be encountering on the main street, or just designing it as a different way in light of what's happened. You've seen CVS do these things in other parts of the country. We're just mirroring what they're doing. I think it's going to become real important in the future as to, designing the workable future design of GHealth. So again, this is just not planned, not orchestrated, just kind of focusing on areas that we find are going to be important. We continue to grow. We have a good relationship with Your Care, which is Molina. We have a good relationship with Vitelis, which is now Centene. And we have United Healthcare, which we have a couple of contracts. So together in the debacle, the value base has been working really well. And they've been we have close to 30,000 lives that are managed there. Urban's, done a really great job. Again, Terrence, with the testing. The testing will continue for a total of 100 days. So during that time, it will help us kind of pick up more patients. And also, if someone's sick, get them tested and sent home right from the locations. And so the Jefferson and the actual Main Street and the Niagara Streets will all open June 1st. And we'll give you more information as that's going to be planned. In terms of the other issues that pop up during the day, make sure, again, let your managers know, and we'll be able to kind of address some of these things. I wanted to make it a short message. If there's other things you want us to report on when we're having this discussion prior to opening, please feel free to let us know. I don't have all the answers, but I'll give you what I know. Thank you, and God bless.